Dennis was a 14-year-old who had been diagnosed with leukemia and was referred to Seattle Children's Hospital to confirm that diagnosis. The diagnosis was confirmed, and he was thought to have about a 70% chance of cure with conventional treatment. Dennis had been removed from the custody of his biological parents and placed in the custody of his aunt about 3 years prior to that time because his parents had been abusing drugs and were felt not to be able to take care of him. So Dennis had moved in with his aunt who lived in Skagit Valley, and his aunt happened to be a Jehovah's Witness. Dennis, shortly before his diagnosis, had also joined the Jehovah's Witness church. When he arrived at Children's, he and his aunt both agreed to treatment, but they also made it clear that they were Jehovah's Witnesses and could not agree to blood transfusions. He was started on treatment, and as is always the case, his blood count started to drop after the first week. Now, one of the things that's important to recognize about chemotherapy is that it not only kills the leukemic cells in the blood, but it also kills most of the normal blood cells, which include red blood cells and white cells and platelets. And so those have to be replaced while that toxic drug is in the patient's body. As Dennis's counts began to drop, discussion turned to the need to transfuse him with red blood cells, and at that point Dennis made it very clear that that was not acceptable to him and that he would resist any attempt to transfuse him.